What's going on, guys? My name is Travis with travisprice.com. I'm a licensed insurance agent in the great state of Michigan that focuses on senior health and retirement insurance. So that's Medicare, life insurance, and annuities. In today's video, I just wanted to kind of create a response video for this article that I read in the Record Eagle, which is the paper for Traverse City. It was written by Fred Goldenberg, who is a licensed insurance and financial services rep here in Traverse City. And he's talking about how Medicare Advantage has so drastically improved over the last 18 years and how people in Michigan are more accepting of Medicare Advantage. I'm going to leave a link in the description concerning this article so that you can review it yourself. I'm also going to leave a link concerning my rebuttal to this article and kind of taking you behind the curtain a little bit on how insurance agents, insurance companies, and Medicare really benefit from you using Medicare Advantage, even though you have additional options. I just want to say two things right off the rip. I have nothing against Fred. He's not wrong in anything that he's saying in this article. I think there's some omissions of the argument, but it's not like an intentional misleading to you. I just think that it's something that we're not having the full discussion. Secondly, I don't have any problems with Medicare Advantage. If you use Medicare Advantage, it can be great for you. For other people, it's not a really great fit. And so it's important when you evaluate Medicare choices that you speak with somebody, even if it's not me, about your Medicare choices that is a professional in that industry. They may have differing opinions than I do, but ultimately, at least you can get some insight on what's going on. And you can always subscribe to my channel or ask questions. Or you can go to travisprice.com in order to check out some of my commonly asked question responses and just get more information. So I'm going to briefly go through this article at a very high level and then get into the point of what is the benefit to the major players in Medicare Advantage when they sell you a policy. So that would be your insurance agent, the insurance company, and Medicare. And then we're going to briefly talk about other options that you may want to consider. It doesn't, and why they don't bring these up. It doesn't mean that you have to choose them. It's just, another avenue to consider. So let's talk about Fred's article. The first kind of 3 paragraphs are talking about what Medicare Advantage is when it was introduced and the initial rollout, which was really poor. It's improved over time, and that Michigan seniors are more accepting of Medicare Advantage. A lot of it has to do with marketing, with the barrage of television advertisements and mail advertisements, but also it's a blending of public and private sectors that benefits both participants. So eHealth does a study, talks about how much Medicare Advantage has grown. It also talks about the expanded offerings and zero premium Medicare Advantage plans. And then also the cost increases, and it really highlights that the average Medicare supplement has increased approximately $36 a month over the last year. It doesn't give a lot of context as to why Medicare Advantages have only slightly increased along with drug plans. Then we start talking about the offerings that Medicare Advantage has improved upon, such as maximum out-of-pocket exposure, which is when you pay for services, whether it's your doctors, your hospitals, your physical therapist, or whatnot, has actually decreased. That maximum out-of-pocket has decreased. almost $600 since 2018, while the services offered by Medicare supplements have decreased. So benefits he's selling have increased with Medicare Advantage, while with Medicare supplements have decreased. So, like I said, there is a lot of truth here. There's not a lot of misinformation. It's just that there's some omissions of some arguments. And we're going to kind of jump into that when we talk about each participant and why they really like this product or really push this product versus a Medicare supplement. I did write a response, which you can check out in the link. It offers a response on why Medicare Advantage is very popular and also includes videos on how to make those decisions, whether a Medicare Advantage or Medicare supplement is good for you, how to select a Part D plan. There's a lot of great content there. You can also check that out in the description. But let's go ahead and jump into the second portion, which is what are the benefits to each of the players in Michigan about Medicare Advantage versus a Medicare supplement plan. So, just starting out, it's all about money. No matter what party we're talking about, it's about money. So, for the agent, there's two major features that Medicare Advantage improves upon. The first is that Medicare Advantage, the first year that you're on Medicare, pays a substantially higher rate in commission than the second year. But the commission rate is pretty much flat, meaning that it gives you whatever the rate that Medicare determines is the maximum commissionable rate every year, so as long as you have the policy. This differs with Medicare supplements here in Michigan because most companies only pay you full year commissions for 3 years. After the 3 year, it drops significantly. Basically, you're not getting paid anything after year 3. So I have to come back and say, hey, do you want to flip if I want to keep you at that first year? With Medicare Advantage, it stays at that constant rate as long as they're certified to offer the program and you keep the policy. Even if you switch to a different policy, as long as they keep you as a client, they still get paid. There's also an additional benefit whenever you sign someone up for a Medicare Advantage plan with most carriers these days, which is a value-based enrollment. It's a brief survey. I think it's about 12 questions long, and it gives the agent an additional bonus to his flat commission between $50 to $125. So let's say you're a first year person on Medicare and you select a Medicare Advantage plan. The insurance agent will probably make about $700 just off that Medicare supplement or Advantage plan. I'm sorry. In year 2, that'll get and beyond, it'll get slashed to about 250 to 280. Just depends on the year and what the insurance company pays the insurance agent. Number 2, because they're selling you a zero cost premium insurance policy or a premium free insurance policy, they actually open up a lot more money because you're not paying for Medicare Part B and a Medicare supplement and a drug plan. So what a lot of insurance agents like to do is they like to add on extras. The most common one is a hospital and cancer plan. So hospital plan will cover part of your deductible when you go into the hospital under Medicare Advantage. Cancer plans give you a lump sum payment when you sign up for Medicare Advantage. It doesn't cover it 100% until you meet that maximum out-of-pocket costs. So you'll have additional costs with that. They also like to pitch life insurance and annuities. Generally, they can't touch life insurance and annuities at the initial appointment. So they're building you up for future sales. They can talk about hospital and cancer plans if you allow them to, but you have to give them permission to, and that's called the scope of appointment form that they'll have you fill out before you talk about any specifics in Medicare Advantage. So the next thing that we want to kind of touch bases with is the insurance companies who love Medicare Advantage. And there's a few reasons why, but the biggest one is they shift the premium um, exposure, so the monthly cost of the plan, off of you and onto Medicare. So Medicare pays a fixed rate per Medicare Advantage enrollee. And then the insurance company's job is to administer the Medicare program to you. The second benefit that insurance companies get is that with original Medicare and a Medicare supplement, the insurance company has literally no leeway in deciding how much to pay, if a claim is approved or denied, uh, or anything along those. They can't make you do prior authorizations. Medicare does all of the decision making concerning claims, and Medicare is generally very generous with claims processing. So the insurance company has to pay their portion. I'll leave a card at the top that talks about how Medicare supplement plans work. So you can check that video out if you're interested. So the insurance company gets access to additional cost saving measures that original Medicare and Medicare supplements don't. The first and the most important is that they can charge you co-insurance, co-pays, and deductibles when you get service. So if you go into the doctor, they can say, hey, you got to pay a $20 copay every time you see the doctor. If you see a specialist, it can be $40. If you see somebody that's out of network, it can be $40 to $50. If you can see them at all, and we'll talk about that in a second. The second benefit that they can really push for cost savings is prior authorizations. So with original Medicare, essentially, if you go to the doctor and he says you need a knee surgery, Medicare approves the knee surgery, the insurance company pays their portion, and you're done. With Medicare Advantage, they can require you to try physical therapy and get knee injections prior to getting surgery because it's the cheaper expense. So it's cheaper to give you physical therapy and injections as opposed to paying for a surgical intervention, which may resolve the issue completely. So they're going to do the cheapest first and move to the most expensive. Finally, they get access to networks, which the only network that you have to worry about in original Medicare is, does the doctor or facility accept Medicare or not? If they don't, then they won't accept your insurance. 99% of providers, I think, accept Medicare. So it's very rare that you run into somebody that doesn't accept Medicare. And if the insurance or the provider accepts Medicare, they don't even need to worry about the Medicare supplement because they don't bill the Medicare supplement. Medicare sends the bill to the Medicare supplement after they approve their costs. Networks are a great tool to put doctors under contract so that they don't have to pay as much. It also can remove doctors annually when they redesign the program, which they do that annually. That's why you re-review and re-sign up for a plan every year or do nothing. And that's essentially saying, I don't want to do anything, we're re-signing up. Doctors can also say, well, I'm just done with this program with Medicare Advantage or this doctor specifically, and they just exit the Medicare Advantage network or even accepting it. And then you either have to pay out of pocket 100% to see that doctor or go see another doctor. What that does is allows the insurance company to reduce the cost that they pay providers. Medicare also does that because they cap the amount that a doctor can charge, but there's not that fluctuation of enter exit, right? So on the original Medicare side, the doctor makes a decision on Medicare Advantage, the doctor or the insurance company can decide to cut the contract. There's also a really great article that I have in my response from OIG in 2018 that found when Medicare Advantage claims were denied, 75% of those denials are reversed in the appeals process. Now, why is that an issue? It sounds great, right? The issue is that they're denying the claims incorrectly in the first place. So you have to go through the hula hoops of setting up an appeal and winning that appeal um, when you're sick. So let's say you have cancer and they deny a treatment, you have to appeal while you're sick, going maybe through chemotherapy or prolong getting that treatment because they've denied your claim, and then later they'll come back and say, yeah, it sounds good. So that's kind of a pain. I don't think anybody that's sick should be having to deal with claims processing, but it's there. The final player here is Medicare, and Medicare is like the least like problematic of the three. The long story short is Medicare makes or saves money by paying the insurance company a flat rate per enrollee so that they don't have to deal with claims. So just all that administrative work and cost just pushes right onto the insurance company, and Medicare washes their hands of the claims processing responsibility. So those are the three big players. That's the least egregious. Let's kind of talk about a little bit of the options that you have here. So, like I said, Medicare Advantage can be really great for the right person, but no insurance professional should skew benefits of Medicare Advantage or Medigap plans in order to favor the recommendation process for the generalized population. So what does that mean? I shouldn't tell you right now that a Medicare Advantage plan is good for you. And the reasoning why is because you may have uh, a health concern that is chronically putting you in the hospital, making you go to specialists, making you have surgeries. I don't know what's up with you. And so for me to say, oh, yeah, Medicare Advantage plans are great, uh, influences you without me even knowing anything about you. So personalized um, choices are always going to be paramount. So anybody that tells you that Medicare Advantage plans are great and you get all these additional benefits, blah, 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 is selling you. You are the product. And so it's very important that you acknowledge that Medicare Advantage plans are very um, important to evaluate on your needs and your risk tolerance, not the stuff that they say that they give you. Prime example about this is all those extra benefits. People love having dental and vision insurance and love having that free um, gym membership and love getting, some over-the-counter drugs benefits. They'll pay you a certain amount to purchase over-the-counter drugs. The downside of that is that all of that stuff is not covered under original Medicare, and at any point in time, the insurance company can restructure the contract, reduce the benefits or improve them, or eliminate them altogether. That's a choice they have. And if it's costing them too much, they're going to slash those benefits, and you're just going to have the medical. So he talks about a decrease of maximum out-of-pocket exposure. But what he doesn't mention is that there are other plans, specifically a high deductible plan G, that works very similarly to how a Medicare Advantage plan works medically. So the same services, essentially the same cost when you go and use services. But for a premium of $30 or $60, it slashes the maximum out-of-pocket cost to about half. Why don't insurance agents tell you about this? Because they don't make anything off of it. I get $72 a year selling a high deductible plan G. I don't make anything. Where Medicare Advantage, if I say, oh yeah, this Medicare Advantage plan essentially does the same thing, I'm making anywhere from $350 to $700 off of that policy by itself. So when he's talking about Plan Part D drugs in this article, he's Also mentioning that the $22 a month, most people don't pay that much in Michigan. It actually is closer to $10 to $15. But there are plans that charge more because you're paying less for your prescriptions. So it's important that you know how to pick a Part D plan, as opposed to just buying into it costs $22 a month, because usually most people that's not the case. There is a video on the article that I published that you can kind of go and figure out how to select a Medicare drug plan if you're interested in that. Like I said, I don't think Fred's trying to deceive you. I don't think he's doing anything nefarious. I think that he has a job to do, which is market to you and make you go to a seminar, right? That way he can kind of roll you into a plan. That's the goal. You go to a seminar where he says no sales talk so that he can gather your leads and then follow up with you about your plans. That's the goal. My goal is only to figure out the balanced viewpoint up front and allow you to make that decision. And I do have another article in the description that tells you how to make a decision on how to structure your Medicare choices by just answering one question. So I would definitely check that article out if you're new to Medicare. Again, if you're interested in reading either one of these articles, check out the description. My name is Travis Price. I'm a licensed life and health insurance agent in the great state of Michigan that focuses on seniors and senior financial situations such as Medicare, life insurance, and annuities. Thank you so much for your time and have a great day.